The province will start rolling out fourth doses of COVID-19 vaccines to long-term care residents in light of the Omicron variant. The move was announced by the Ontario government on the same day tougher measures for LTC homes take effect.
We didn't tell him because that would have upset him. So we said, we'll see you soon.
For Carly Chalmers, it's back to virtual visits with her grandfather over Zoom.
Having someone with Alzheimer's especially, it's hard to say when I'll see him next and if he'll even remember me by then.
The latest numbers from Ontario show 58 long-term care homes are currently dealing with COVID-19 outbreaks, with nearly 200 residents and more than 300 staff infected, prompting the province to lock down long-term care once again. Starting today, homes like the one behind me will be off limits to general visitors, except 2 designated caregivers per resident. Residents will also not be allowed to leave their facility for social reasons, a policy advocates are calling discriminatory.
Many residents would much rather risk COVID-19 than miss another birthday, hug, or even a walk outside.
For many people, it's very re-traumatizing.
Dr. Amit Arya works on the front lines of long-term care and says most outbreaks are not linked to social visits or outings, but generally from well-meaning staff who are asymptomatic.
We haven't done enough to protect the staff. We're not mandating N95 masks. We're not increasing rapid testing. But somehow we expect this virus is going to stay out of long-term care simply by limiting the number of essential caregivers to 2.
As for boosters, at least 84% of residents have received theirs, but only some 43% of workers have had a third shot. Announced today, residents will become eligible for a 4th jab 3 months after receiving their first booster, and third doses will be mandated for staff.
And requiring visitors to provide proof of vaccine or a booster to enter the home once the temporary pause on general visitors is lifted.
We see family members throwing up their hands saying we've done everything that we're supposed to do. We've been vaccinated, we've been boosted. We'll make sure that our loved ones in long-term care get a 4th. Cutting people off from the rest of the world is not an answer.
More protection for her grandfather provides more peace of mind for Chalmers, who wonders why it's not enough now.
He's boosted, we're all boosted, we wear PPE when we enter. And then to think, despite all of this, we still can't see him. I really hope that this would be the last time. Preparations are already underway for those 4th doses. Michael Garrett Hospital tells CityNews it's been working with its LTC partners on a plan to start administering them as soon as possible. Caryn Ceolin, CityNews.